I'll turn it over to Mikia Wallis. Take it away.
Great. Thank you so much. And thank you, Congressman, so much for your support. It was very critical in getting us through what has been an incredibly unprecedented time. We launched our COVID Clinic Command Center back on March 6th. And really, as many watching today will remember, the world really fell apart a week later on Friday the 13th when schools shut down without any kind of clear sense of when they would reopen. And we really struggled at that point to find enough PPE to keep our clinics open, but we were, because of, in part, the support from you and members of Congress and our elected officials at all levels, able to keep the vast majority of our clinics open, and fortunately the majority of our staff employed, although we did have some heartbreaking losses as well. Borrego Health operates over 50 sites of care across 3 counties in Southern California. Last year, in 2019, we saw over 260,000 patients. And so we're very proud to be part of this solution to the COVID-19 pandemic. Our patients, as you mentioned, are some of the most vulnerable people who are our neighbors and loved ones. The populations that we serve are historically marginalized, people who do live in poverty. Borrego Health is also the recipient of a specific grant designation for migrant and seasonal agricultural workers who were also significantly impacted by the effects of the pandemic as well. And so we've been very fortunate to be able to continue to serve, particularly as it relates to being able to provide COVID-19 testing. As an organization, we've performed over 20,000 tests since the beginning of the pandemic, and been able to test a number of people both in our clinics, which in northern San Diego County, we have a large site in Escondido. So we've been able to test a large number of individuals in our clinics, as well as in community testing events using our mobile pop-up solutions. Some of our staff have had to get pretty creative and definitely have been warm in this latest heat wave, standing outside in their full PPE with face masks and gowns to conduct testing for people in a drive-through setting, but that's just one of the many ways that community health centers really have been able to innovate during this time to continue to provide care to the communities that need us. Another way that we've been able to innovate is by being able to provide services by telehealth and by telephone visits. And so many of our patients who have pre-existing or chronic conditions who require regular touch points with their primary care provider are able to continue to receive care as a result of the expanded access to telehealth that was made available for community health centers back at the beginning of the pandemic too. So that's been something that's really important to our communities and really important to us as a healthcare provider. We're happy to be here today, happy to answer your questions, and happy to be able to continue to provide care to the communities that we're a part of, that we love so much, continue to provide testing so that we can send our kids back to school, hopefully soon, mine included. So thank you so much for having us, and happy to answer any questions.